And I was never talking about people who are hesitant towards a vaccine, but trying to be reasonable about it and trying to stay safe. My point was that there are people who are deliberately trying to stir up hate and intolerance and misinformation, and we do need to call out those folks.
Public trust in big pharma-centric public health vaccine programs is dropping in North America. It's a trend that highlights how COVID-19 related public health measures eroded the general public's confidence in public health, how they damaged their own credibility and fostered skepticism, which has served only to empower people to take control of their health and break free from the customer-generating chains of the pharmaceutical industry. Tamara Ugolini here with Rebel News, and recently the United States' Center for Disease Control and Prevention, also simply known as the CDC, released a report last week that showed vaccine exemption rates for childhood vaccinations is increasing. The data highlights national coverage for select vaccines and exemptions from school vaccine requirements in kindergartners for the 2022/2023 school year. It was discovered that national coverage with state-required vaccines among kindergartners declined from 95% to approximately 93%, and that the exemption rate increased 0.4 percentage points to 3%. Likewise, exemptions increased in 41 states, exceeding 5% in 10 states. The CDC claims that this implicates the public health practice of mass vaccinating children against vaccine-preventable diseases like polio, diphtheria, measles, mumps, and pertussis, otherwise known as whooping cough. They state that exemptions greater than that 5% limit the level of achievable vaccination coverage, which increases the risk for outbreaks of vaccine-preventable diseases. This represents a year-over-year drop of 1 percentage point in vaccine coverage since 2020 and 2021, the COVID pandemic era, proving that public trust in vaccination programs is dwindling as the health necromancers have overplayed their hand by forcing the masses to comply with unscientific and unfounded facial decorations, causing massive and grotesque harm through suppressive societal and economic lockdowns, all using horrific mandates to justify the above-mentioned actions. The CDC claims that national mRNA coverage among kindergarten students remained below the Healthy People 2030 target of 95% for the third consecutive year. They state that to achieve that target of 95% MMR coverage, exemptions cannot exceed 5%. Now, I wasn't able to find any scientific basis for that arbitrary percentage, but based on the U.S. Department of Health and Human Services Office of Disease Prevention and Health Promotion website, I was able to find information on how to maintain this coverage, which included the summary evidence that requiring children to have this vaccine for school entry increases vaccination uptake. On that page, there is also an evidence-based resources section, which is mostly about what is most effective to nudge people into compliance with vaccination and has nothing to do with where that 95 percentage point comes from, other than the fact that it's guidance issued by the World Health Organization. The WHO recommends 95% coverage to prevent measles outbreaks, but again, their link doesn't include any scientific evidence to back up that number. They do mention Immunization Agenda 2030 3 different times, though, while emphasizing that vaccination uptake is also at an all-time low globally. So, what about Canada? The most recent survey was from 2021, called the Childhood National Immunization Coverage Survey, or CNICS. It's structured differently, but the demographics for 7-year-olds, that's the demographic most closely related to the CDC's kindergarten exemption group, has also seen a drop in vaccine uptake. You can see from infographic number 2 on immunization coverage by antigen for children aged 7 years that uptake for that demographic has not reached the 95% threshold set out by the Public Health Agency of Canada, which is denoted by that solid black line. The blue line was uptake rates in 2019 versus the orange line, which is uptake rates for 2021. And almost all pathogens except rubella and varicella, which is chickenpox, have declined. DTaP, the 4-in-1, which is diphtheria, tetanus, and pertussis, again, that's whooping cough, vaccine coverage dropped from 78.1% in 2019 to 71.9% in 2021. The trend seems to continue across various jurisdictions. For instance, in southeastern Ontario, the Haliburton-Kawartha Pine Ridge District Health Unit said that roughly 6,300 of the health unit region's 20,000 students scheduled for immunization still have incomplete records. That represents 31.5% of students. Likewise, in southwestern Ontario, the Middlesex London Health Unit said in January of this year that in the 2018/19 school year, 98% of grade 2 students were vaccinated against measles. This year, 51% were immunized. That is a massive drop. And that could be why the Government of Canada put out 2 different video campaigns on childhood vaccines, like this one, urging parents to trust the facts.
It's a bit chilly. Where's the baby's hat?
Here's how I stop meltdowns in 3 easy steps.
Listen, just sleep when the baby sleeps.
Everyone's got opinions. When it comes to childhood vaccines, rely on the facts. Childhood vaccines have been around for decades and are safe and proven to help protect children against 14 preventable diseases. Learn more at canada.ca/childhood vaccines. A message from the Government of Canada.
It's all a prime example of how public health has tarnished its own reputation throughout the COVID hysteria, whether it was forced isolation and quarantine of the healthy through suppressive lockdowns, the harm imposed on children by school closures and community isolation, the messaging that they were super spreaders who would kill their grandparents if they hugged or dare bare their naked faces in public, the backtracking on statements about masking, and then, of course, the forced indiscriminate masking of everyone. The changing narrative around vaccine effectiveness from 100% effective to it doesn't stop the spread or infection, followed by the unrelenting push for vaccination and novel pharmaceuticals that disregarded individual choice, individual medical history, body autonomy, and what Canadians thought were protected chartered rights to the above. And of course, the concerted effort to suppress, stifle, and censor early treatment options, which paved the way for increased public awareness of the compromised state of medical research and legacy journals by big pharma interests. Health authorities and their regulatory colleges played a key role in delegating all of the above out to doctors who disseminated and took a one-size-fits-all approach onto their patients. Anyone who didn't was stripped of their license to practice medicine, was smeared and slandered into complying for fear of their reputations. And all it's done is serve to damage the public health brand for following the political science instead of the evidence-based science. The proof is in the pudding. People are questioning the pharma industrial complex and are seeking out ways to become health empowered so they can access cures instead of becoming pharma customers. For Rebel News, I'm Tamara Ugolini. The safety and efficacy of these novel biological products are continually called into question. If you would like to see Federal Health Minister Mark Holland revoke market authorization for the novel COVID-19 vaccines, then please visit our website at nomoreshots.ca. At that website, you can sign our petition, you can send an email to Minister Holland, and you can support our ongoing journalism on this topic. All of that and more can be found at nomoreshots.ca.